Hey, stop what you're doing right now, because what I'm about to share with you could literally save your life, and I promise you, your doctor has probably never spent more than 90 seconds talking to you about this. I'm Dr. Thomas, and today we're going to talk about the number one cause of heart attacks. And no, it is not what you think it is. Most people believe it's cholesterol. The media has been saying it for decades. Your doctor hands you a statin prescription and sends you home feeling like the problem is solved. But here is what the research actually shows, and what most mainstream medicine has been tragically slow to acknowledge. Cholesterol is not the villain. Inflammation is. And there is one specific type of inflammation, one specific marker in your blood, that predicts your risk of a heart attack better than anything else. And the terrifying part is, most doctors never test for it. A landmark study published in the New England Journal of Medicine followed over 27,000 patients and found that people with elevated levels of a protein called C-reactive protein, even those with perfectly normal cholesterol, were twice as likely to suffer a fatal heart attack or stroke. Twice. That means millions of Americans walking around thinking they're fine because their cholesterol numbers look okay, when in their blood, there's a silent fire burning through the walls of their arteries. Today I'm going to walk you through exactly what this marker is, what causes it to spike, how to test for it at home and with your doctor, and the 5 most powerful, scientifically validated ways to bring it down fast, especially if you are over 60, because after that age, your body handles inflammation very differently than it did at 40. And I need to tell you right now, number 2 on today's list is something 94% of seniors are completely deficient in, and you will not believe how simple and inexpensive the fix is. So make sure you stay with me until the end. But before we dive in, I want to ask you something personal. Leave a comment below telling me your age and whether your doctor has ever tested you for CRP, which stands for C-reactive protein. I read every single comment on this channel. Your story matters, and you might just help someone else by sharing it. Now let's get into it. So, what exactly is CRP, C-reactive protein, and why should it scare you more than your cholesterol number? Think of your arteries like a garden hose. When that hose is healthy, water, or in this case blood, flows through it smoothly. But when inflammation starts attacking the inner lining of those vessels, it's like someone is slowly crimping and roughening the inside of that hose. Plaques start to form. The walls get thick and rigid. And one day, a piece of that plaque breaks off, a clot forms in seconds, and the blood supply to your heart is cut off. That's a heart attack. And the engine driving that entire process, from the first damage to the final clot, is chronic inflammation. CRP is the smoke detector. It tells us that the fire is burning. Now, you can test for this. Ask your doctor for a high-sensitivity CRP test, sometimes written as HS-CRP. It's a simple blood draw. Your target is below 1 milligram per liter. Between 1 and 3 is moderate risk. Above 3 is high risk. Above 10 means there's active inflammation happening right now, possibly from an infection or autoimmune condition, and it needs immediate attention. This test costs almost nothing, often under $20, and yet it is not part of most standard blood panels. That should make you furious, and it makes me furious. So now, let's talk about the 5 most powerful ways to drive that number down and protect your heart, ranked from helpful to absolutely essential. Coming in at number 5, and this one surprises people every single time I mention it, it's your gums. Yes, your mouth. Periodontal disease, that's the medical term for serious gum infection, is one of the most underappreciated drivers of systemic inflammation in the entire body. The bacteria that live in infected gum tissue don't stay in your mouth. They enter your bloodstream every single time you chew, brush, or even swallow. And once they're circulating through your body, they trigger an immune response that sends your CRP levels skyrocketing. A study from Harvard School of Public Health found that men with a history of gum disease had a 49% higher risk of developing heart disease compared to those with healthy gums. And the research from the American Journal of Cardiology showed that after treating periodontal disease, patients saw significant reductions in their CRP levels, in some cases dropping by over 40% within 6 weeks. For seniors specifically, this connection is even more dangerous because as we age, our immune response becomes what scientists call dysregulated. It's slower to respond to new threats, but quicker to stay stuck in a low-grade inflammatory state. A chronic gum infection is like pouring gasoline on that smoldering fire. Here's what I want you to do. See a periodontist, that's a gum specialist, at least once a year. Floss every single night. And consider using a water flosser if traditional flossing is difficult for your hands. Oil pulling with coconut oil for 10 minutes in the morning has also shown modest benefit in small trials. Pair your oral care routine with vitamin C, around 500 milligrams per day, because vitamin C is critical for collagen production in the gums, and most seniors are running low on it. This is the foundation. Now let's go deeper. Number 4 on our list is something that your grandparents probably used, and modern medicine largely forgot about, and that is omega-3 fatty acids, specifically from marine sources like fish oil. Now, I know you've heard about fish oil before, but I want to give you the details your doctor probably never explained, because there is a right way and a wrong way to take it if your goal is specifically lowering CRP. The two compounds in fish oil that matter are EPA and DHA. That's eicosapentaenoic acid and docosahexaenoic acid. Don't worry about the full names. What you need to know is that these fats directly block the production of inflammatory chemicals in your body called prostaglandins and interleukins. Think of prostaglandins like little arsonists. They run around your bloodstream, starting inflammatory fires in your artery walls. EPA and DHA essentially put handcuffs on those arsonists. A meta-analysis published in the journal Circulation reviewed 68 randomized controlled trials and found that omega-3 supplementation significantly reduced CRP levels, with the greatest benefit seen in people over 65. After age 70, your body's natural ability to produce anti-inflammatory compounds drops by nearly 35%, which means external sources like fish oil become not just helpful, but genuinely critical. The dose that research supports for CRP reduction is between 2 and 4 grams of combined EPA and DHA per day, not total fish oil, but combined EPA and DHA specifically. Check your label carefully. Take your fish oil with your largest meal of the day and always pair it with a little vitamin E, even just from a handful of almonds, because vitamin E helps prevent the omega-3 fats from oxidizing in your body, which would actually make inflammation worse, not better. I have a patient, Margaret, 71 years old from Baton Rouge, Louisiana, who came to me with a CRP of 4.8, solidly in the high-risk category, and cholesterol that was perfectly normal. Her cardiologist had cleared her. Within 4 months of targeted omega-3 supplementation alongside dietary changes, her CRP dropped to 1.1. She told me she hadn't felt that good since her 50s. If you're finding value in this information, I need to ask you a favor right now. Take 2 seconds and hit that subscribe button and give this video a like. I post new evidence-based health content for seniors every single week, and it is my mission to make sure this information reaches every person who needs it. YouTube's algorithm only shares this with more people when you engage, so please, subscribe, like, and share this with someone you love. Now, number 3. Number 3 is going to shock you, and I don't say that lightly. The third most powerful driver of CRP reduction in aging adults is your sleep, specifically the quality of your deep sleep. Most people think of sleep as passive. You close your eyes, you rest, you wake up. But during deep sleep, what scientists call slow-wave sleep, your brain runs a cleaning process called the glymphatic system. Think of it like a dishwasher for your brain. It flushes out toxic waste products, including inflammatory proteins. When you don't get enough deep sleep, that dishwasher never runs a full cycle, and those inflammatory compounds accumulate in your tissues and bloodstream. Research from Emory University found that adults who slept fewer than 6 hours per night had CRP levels that were 3 times higher than those who slept 7 to 8 hours. And here's what makes this especially devastating for seniors. After age 65, the amount of deep sleep you naturally get drops by approximately 80% compared to your 20s. You might be in bed for 8 hours, but only getting 45 minutes of truly restorative sleep. This is not laziness. This is biology. And it's one of the reasons inflammation accelerates so aggressively in our later years. What can you do? First, eliminate all blue light, from phones, tablets, and televisions, at least 90 minutes before bed. Blue light blocks melatonin, which is the hormone that signals your body to enter deep sleep. Second, keep your bedroom temperature between 65 and 68 degrees Fahrenheit. Research consistently shows this is the optimal range for deep sleep in older adults. Third, consider magnesium glycinate, around 300 to 400 milligrams taken 30 minutes before bed. Magnesium is involved in over 300 biochemical reactions in the body, including the regulation of the GABA system in your brain, which calms your nervous system and dramatically improves deep sleep quality. Pair it with a small amount of tart cherry juice, about 4 ounces, which contains natural melatonin precursors. The combination is remarkable. A patient of mine, Gerald, 76 years old from Phoenix, Arizona, had been struggling with poor sleep and high inflammation for years. He was on 2 medications and still feeling exhausted every morning. We optimized his sleep environment and added magnesium glycinate and tart cherry juice to his routine. Within 8 weeks, his sleep tracker showed he was getting nearly double the deep sleep, and his CRP dropped from 3.9 to 1.7. Gerald told me he felt like he'd gotten his life back. Number 2, and I told you this would surprise you, is vitamin D3, not vitamin D, D3 specifically. And the reason 94% of seniors are deficient is not because they don't try to get sun, it's because after age 70, your skin's ability to synthesize vitamin D from sunlight drops by approximately 70%. You could sit in the sun all afternoon and still produce a fraction of what a 30-year-old would in 20 minutes. This is one of the most consequential and overlooked facts in all of senior medicine. Vitamin D3 is not just a vitamin. It functions more like a hormone. It has receptors in nearly every cell in your body, including the immune cells that control inflammation. When D3 levels are low, your immune system loses one of its primary off switches. Inflammatory pathways stay activated, CRP climbs, and your arteries pay the price. A study from the University of Colorado found that vitamin D3 supplementation reduced CRP levels by an average of 25% in adults over 60 who were deficient, and deficiency is defined as blood levels below 30 nanograms per milliliter. Most seniors I test are sitting between 12 and 18. The research-supported dose for seniors is between 2,000 and 5,000 IU of D3 per day, taken with your fattiest meal because D3 is fat-soluble, meaning it requires dietary fat to be absorbed properly. And here is the critical synergy tip that most people miss. You must pair vitamin D3 with vitamin K2, specifically the MK7 form. Here's why this matters enormously. Vitamin D3 increases calcium absorption, which is great for your bones. But without K2, that calcium can deposit in your arteries instead of your bones, actually worsening cardiovascular risk. K2 acts like a traffic officer, directing calcium where it belongs. A combined D3 and K2 supplement is the smarter choice. Around 100 micrograms of K2-MK7 alongside your D3 dose. Get your vitamin D blood level tested, ask for a 25-hydroxy vitamin D test, and retest in 90 days to make sure your levels are rising. I want to tell you about Dorothy. She's 79 years old, lives in Cleveland, Ohio, and came to our practice after her third cardiologist told her there was nothing more they could do. Her CRP was 5.6. Her vitamin D level was 11, critically deficient. We started her on 4,000 IU of D3 with K2 daily. We adjusted her nutrition and sleep. Within 5 months, her CRP was 1.4. Her energy was transformed. She started walking a mile every morning. She said to me, "Dr. Thomas, I feel like someone turned the lights back on." That is why I do this work. And now, the #1 cause of chronic inflammation leading to heart attacks, the one marker that matters most, the one intervention that outperforms everything else in the research, and that is visceral fat. Not the fat you can pinch on your arms or your stomach. Visceral fat is the fat that lives deep inside your abdominal cavity, wrapped around your organs, your liver, your kidneys, your intestines. And unlike regular fat, visceral fat is metabolically active. It behaves almost like a gland, pumping out inflammatory chemicals called cytokines 24 hours a day, 7 days a week, directly into your bloodstream and surrounding your heart. Research from the Cleveland Clinic found that people with high visceral fat had CRP levels averaging 4.7 milligrams per liter, nearly 5 times the target, regardless of their weight on the scale. This is why we see heart attacks in people who look perfectly healthy. They might not be overweight by any outward measure, but internally, the fat surrounding their organs is quietly setting their arteries on fire. After age 65, your body shifts fat storage toward visceral deposits due to declining hormones, estrogen in women, testosterone in men, and reduced mitochondrial efficiency. Your mitochondria, which are the little energy factories inside your cells, become less effective at burning fat as fuel, and more of what you eat gets stored viscerally. How do you measure it? A waist circumference above 35 inches in women and 40 inches in men is a strong clinical indicator of dangerous visceral fat accumulation. Ask your doctor for a DEXA scan, that's dual energy X-ray absorptiometry, which can precisely measure visceral fat. Some facilities now offer this for under $100. How do you reduce it? 3 strategies work synergistically and are all backed by strong clinical evidence specifically in older adults. First, time-restricted eating, compressing your meals into a 10-hour window each day, for example, eating only between 8 a.m. and 6 p.m. Research from the Salk Institute showed this approach reduced visceral fat by up to 11% in 12 weeks without any caloric restriction. Second, resistance training, not running, not walking, but lifting weights or using resistance bands at least twice per week. Muscle tissue is one of the few things that can increase your resting metabolic rate and tell your body to mobilize visceral fat stores. After age 70, this becomes the single most important form of exercise for metabolic health. Third, reducing refined carbohydrates, specifically white bread, white rice, sugary drinks, and ultra-processed foods, because these spike insulin, and chronically elevated insulin is the primary hormonal driver of visceral fat accumulation. Pair these three strategies with daily walks of at least 30 minutes after meals. Postprandial walking, that means walking after you eat, has been shown in multiple Japanese and Italian studies to reduce blood sugar spikes by up to 30%, which directly reduces the insulin signal that tells your body to store fat viscerally. And when you combine all 5 strategies we discussed today, addressing your oral health, optimizing omega-3 intake, fixing your sleep, correcting your vitamin D, and directly attacking visceral fat, you are not just lowering a number on a blood test. You are systematically dismantling the process that leads to heart attacks. You are putting out the fire. I want you to sit with this for a moment, because here is what this is really about. This is about being there. Being there when your grandchildren need you. Being independent in your home on your own terms. Waking up with energy and purpose, not fear and fatigue. Heart disease does not have to be inevitable. It is not simply the price of getting older. It is the result of specific, measurable, correctable processes happening in your body right now, and every single one of them can be addressed. You are not too old. It is never too late. I have seen it in Dorothy and Gerald and Margaret and hundreds of patients just like them. The body, given the right tools, has a remarkable capacity to heal at every age. You deserve that healing. If you are not already subscribed to this channel, please do it right now. I upload new videos every week focused entirely on helping you live longer, stronger, and more independently. Click that subscribe button and ring the notification bell so you never miss an episode. All of the scientific references I mentioned today are linked in the description below, and I want to hear from you in the comments. Has your doctor ever tested your CRP? And after everything we discussed today, which of these 5 strategies are you going to start with first? Tell me below. I read every comment. Your health is not an afterthought. It is everything, and I'll see you in the next one.